how do you see the future for the NPA?
Shall I answer this?
Yeah, please, John.
I think the important thing to acknowledge, first of all, in terms of the environment, that members are feeling very squeezed financially at the same time that they're being asked to invest in new services. So it's fundamental for the NPA to focus on two things: how we can improve the revenue for our members and how we can help them reduce cost. And so there's some important elements of that for me. But our core of what the NPA is all about being a trade association and supporting our members. And we're doing that in terms of representation, in terms of support and in terms of protection. So in terms of moving forward, the vision for the NPA is to powerfully represent our members and their interests and to be very innovative in terms of the services that we provide. And if we can do that, then our members will allow us to provide leadership to community pharmacy as a whole. I don't know if you wanted to say anything else.
I think that captures it very succinctly, John. I think we're an organisation that needs to listen to our members as well. So we've got a good understanding of what their needs are and how the NPA can best support them. Because we've been holding a number of engagement events with members, but we're in constant listening mode. And I think that's really important because we need to stay in tune with what our members really feel at this moment in time and react and respond accordingly.
What do you think the one main issue for your members is at the moment, and what are you going to do to help them?
Well, I think the most important issue for our members is profitability. With all of and the second thing, I suppose, is moving to the new service model from supply to service. And some of the key things that we need to do is, again, being very strong in terms of representation and getting the messages out there in terms of we're looking to invest in new services and to operate those through community pharmacy, and we need new money invested into those services to provide that. The other area, in terms of helping members to roll out new services, if we take some recent examples, for example, our work with the Allergy UK, a major national charity, to provide an allergy screening service, and the most recent one from last week is the work we've been doing over the last 18 months to develop a chlamydia service as part of our sex health education initiative to help members roll those out. So it's very much around implementation of innovative new services.
There are lots of opportunities presented for pharmacy in the white paper. Which of those specifically is the NPA going to be picking up on and helping members with?
I think there are a number of very exciting opportunities in the white paper. I think there's some work to be done collaboratively with the other pharmacy bodies to explore exactly how we're going to bring those to life. But to name two areas only, there are others perhaps of equal importance, but these in particular strike a chord with us. There's the National Minor Ailment Scheme, which is proposed within the white paper, and I think that's something which our members will be very keen to pursue, and I think there will be an expectation that the NPA will provide the supporting mechanisms to enable them to effectively implement a National Minor Ailment Scheme. In a similar vein, a bit of a catch-all phrase, but the directed enhanced services that are proposed within the white paper, for example services around vascular, are equally as exciting, which require a number of supporting structures to be in place. There's some training requirement there. There will be some training requirement not only for pharmacists but also for their support staff. Mechanisms again to be able to fully and effectively implement such a service, and I'm sure our members would be looking to the NPA for support to be able to do that.
Yeah, definitely. Yeah.
How the NPA is going to sit in the future, sort of relative to all the other bodies, obviously.
Do you want to?
Well, if I start,
yes.
and John, please pick up on it. I think clearly there are a number of pharmacy bodies representing community pharmacy. We have a unique membership proposition which is about supporting, in the way that John has articulated, a provision of service support for pharmacy owners. Other pharmacy bodies have other particular remits. I think we therefore need to identify what particular capacity or capability we bring to a particular aspect, and the other bodies would do similar. And then once having identified that, work together in order to improve the lot of pharmacists and pharmacy. If we can grow, an analogy of growing the size of a cake, if we can grow the size of the pharmacy cake, then we will all benefit from that. And I think all of the pharmacy bodies have a part to play in making sure that the size of the pharmacy market, the opportunity that's open to pharmacy owners, operators and individual practitioners grows.
And I think one of the unique strengths that the NPA has is that it is representative of all of community pharmacy across the whole of the United Kingdom. And therefore there are a number of pharmacy bodies, and we need to work very collaboratively with all of those to absolutely maximise all the opportunities. But the strength that the NPA gets is from the strength of its 100% voluntary membership. And for me, that's a very powerful message for the NPA to be able to put forward as a position because of our representative nature.